Welcome to the APhA Advocacy Update. I'm Mason Manuel, and I'm here today with Allison Reichert. She's an APhA member who's going to be presenting at the CMS Burden Reduction Conference on the topic of rural pharmacists' role in chronic disease management. We are going to get right to it, so let's just start. Allison, welcome to the show.
Thank you for having me.
So, Allison, from your experience in a rural setting, how do chronic disease management needs differ in rural communities versus what you've seen in urban ones?
Yeah, so I think that chronic disease management in rural communities looks and feels different than it does in urban communities. In urban communities, patients have multiple clinicians, hospitals, specialists, all within a few miles.
A lot more access.
Yeah, a lot more access. And in rural communities, that's just not the case. Where I live, patients often travel an hour to often see their primary care provider or any type of specialist. They travel an hour, if not further. So what happens is the pharmacist becomes that most accessible healthcare provider in town. And because of this, patients rely on their pharmacists for more. So patients rely on us as pharmacists for anything from blood pressure checks to medication adjustments, all the way to, disease state education that they just can't seem to find easily anywhere else. Mm-hmm. And so you kind of feel the burden of chronic diseases a little bit more intensely in rural communities. So, conditions like diabetes, hypertension, COPD, they show up frequently, but there's just not that infrastructure there to support the ongoing management like there is in urban areas.
So it makes an already busy job even more busy with all of the people relying on them for those expanded responsibilities.
Exactly. So again, what happens is your pharmacist, your community pharmacist becomes that reliable touch point for patients. So a person that they can come to in between appointments that may be few and far between to help keep them stable in between those appointments.
So in your opinion, what are the biggest barriers rural pharmacists face when trying to provide long-term chronic care support?
Yeah, so I think a lot of it comes down to logistics and resources. So a lot of community pharmacies, just like my own, operate with small teams. And so time has to be carved out for chronic care support. Unfortunately, the reimbursement system doesn't fully integrate pharmacists or recognize our clinical role in chronic disease management. So that's a barrier in and of itself. Communication is also another big barrier that we face. A lot of specialists are located in larger cities. And so, getting timely responses or updates can be an issue, especially since the large part of our communication in community pharmacies happens via telephone or even fax. So communication is a big barrier. And then, of course, our patients face barriers. So transportation is a big one.
Sure, yeah.
Lack of insurance coverage. Or in some cases, it's a lack of technology or lack of access to technology for telehealth visits or remote monitoring. So I think in rural communities, all of these pieces, all of these barriers kind of added together just form a more complicated and complex picture when it comes to chronic disease management.
Can you share an example of a time where pharmacy-led chronic care services made a measurable difference in a patient's health outcome or even quality of life?
Yeah, absolutely. So I think one of the biggest impacts that pharmacists can make is making providers aware of acute changes in chronic conditions. So a specific example, I have a routine diabetic patient of mine come into the pharmacy from having visited a walk-in clinic for urinary symptoms, and they present to me with a prescription for an antifungal. I look at the patient's profile, and I notice that they had recently been put on a new diabetes medication, one that I know commonly causes mycotic infections.
Uh-oh.
So, in this instance, I notified the prescriber, let them know what the patient had experienced, and we jointly decided that that wasn't the best diabetes medication for the patient. So with this pharmacy-led intervention, we've done two things. Number one, we've reduced the patient's morbidity that they've experienced. And number two, we have prevented worsening. So worsening of the symptoms, which could lead to further clinic visits, ER visits, or hospital admissions.
If healthcare systems fully leveraged rural pharmacists in chronic care management, what changes do you think we'd see in patient outcomes and even overall healthcare spending?
Yeah, so I think we would see changes pretty quickly, to be honest. Pharmacists see our patients frequently, so we're perfectly positioned to catch problems before they become big problems, before a patient has to go to the emergency room or become hospitalized. I think we would see great improvements with adherence because pharmacists could coach patients in real time. I think we would see a reduction in complications from chronic diseases, so especially diseases like diabetes and hypertension, where they respond really well to a more consistent monitoring. I think overall we would see a decrease in cost because, as we know, treating proactively is always more cost effective than treating reactively.
I'm sure, yeah.
Yeah. And I think, besides the numbers, beyond the numbers, I think that we would see an increase in patient engagement. Rural patients trust their pharmacist. And so if we were able to fully leverage that trust, I think we could create a more connected, proactive model of chronic disease care.
And that makes sense because I understand that people are seeing their pharmacists way more than really any of their other medical professionals, just overall on average.
Yeah, absolutely. It's all about accessibility.
With your presentation for the Burden Reduction Conference, what is one message you're hoping to leave the audience with about the successes and barriers rural community pharmacies face?
Yes, so I think that when we talk about the successes and the barriers of rural community pharmacies, I think I can summarize it in one word, and that word is access. So our success is the access that pharmacists provide to our patients, the access to healthcare that pharmacists provide to our patients. And our weakness, or the breakdown, is the lack of access that pharmacists have to care teams and interoperability. If we were able to modernize communication and fully integrate pharmacists into care teams, I think we would see dramatic improvement in our chronic care management of these rural patients.
Allison Reichert, thanks for coming to the show, and we're looking forward to seeing what you present.
Thank you so much. Thanks for having me.